Welcome to This Explainer. Today, we're cutting straight through the hype to look at exactly how artificial intelligence is completely rewriting the rules of healthcare. We hear so many sweeping promises about AI these days, right? But today, we're strictly grounding our focus in hard data and real-world applications. We're going to explore exactly how AI transforms clinical workflows, making this massive leap from simple digital tools that just kind of help out to fully autonomous agents that are shifting the entire foundation of medical care.
To really grasp the scale of what we're dealing with, let's kick things off with a staggering number: over $450 billion. According to industry data, that is exactly how much is spent annually on administrative waste in the U.S. healthcare system alone. Let that sink in for a second. We are talking about nearly $500 billion every single year that isn't going toward breakthrough treatments, it's not going toward life-saving surgeries or keeping patients healthy, it's going toward paperwork, phone calls, and just the endless, grueling friction required to run a highly complex, bureaucratic system. Healthcare organizations have been desperately searching for relief here for decades.
Section 1. The Healthcare Burnout Crisis. To understand why AI is moving so incredibly fast in this space right now, we have to look past the dollars and cents and look at the severe human cost behind these bottlenecks. Think about a typical physician's workday. Right now, doctors are spending a staggering 49% of their day just doing manual data entry and electronic health records, or EHRs. That means almost half of a highly trained medical professional's time is spent tethered to a desk, staring at a screen and typing out notes, rather than looking a worried patient in the eye. If you've ever been to the doctor and noticed they're just typing the entire time you're speaking, well, this is exactly why. It's a massive structural driver of the burnout crisis we're seeing globally, and it literally strips the humanity right out of medicine.
And honestly, it gets worse. On top of that 49% of their day spent typing, your average physician loses about 13 hours every single week dealing with prior authorization paperwork instead of treating patients. Think about that for a second. Roughly a third of a standard work week is completely lost to bureaucratic red tape, battling insurance companies just to get basic care approved. This specific administrative burden is estimated to be responsible for $35 billion in annual waste all on its own. It is a paperwork nightmare that actively pulls clinicians away from the very thing they spent a decade in medical school training to do.
Section 2. Enter the ambient AI scribe.
This system desperately needs a fix, and that's where we're seeing an active rescue mission for clinicians on the front lines of care. And the speed of adoption here, it is absolutely unprecedented. To give you some context, traditional electronic health records took about 15 grueling years of mandates and incentives to fully scale. AI scribes have achieved massive penetration in just 2 to 3 years. As of March 2025, a staggering 92% of provider health systems were already deploying, implementing, or piloting these AI scribes. Executives aren't just pushing this technology on buyers. Physicians are actively pulling it into their clinics because the return on investment for their daily sanity is just so obvious.
So how does this actually work in practice during a visit? It essentially turns a manual chore into a seamless, automated 3-step workflow. First, the ambient AI simply listens to the natural conversation between the patient and the doctor. No dictation, no weird special commands required. Second, it instantly generates a structured, highly accurate clinical note in real time right while the appointment is happening. And finally, it pushes that drafted note directly into the EHR for the physician to review and sign off on. The doctor goes from spending 10 minutes meticulously typing out every detail to spending maybe 30 seconds reviewing and approving the work. Startups like Abridge and Suki are grounding this technology in reality right now. They've built deep, secure integrations with major electronic medical record systems and are successfully saving clinicians over 2 hours a day. They basically act as highly intelligent digital assistants sitting right there in the exam room, and the market is responding aggressively to this. Abridge, for instance, recently secured a valuation of $5.3 billion. That massive number isn't just tech hype, it's a direct reflection of desperate doctors finally getting their evenings back. It's eliminating what the industry calls pajama time, where physicians are stuck spending their nights catching up on charts at the kitchen table.
Section 3. Automating the back office.
Now, the front office revolution is incredible, but it's really just the beginning of the story. Behind the scenes, there's this massive, invisible machine running the modern hospital. And organizations are aggressively deploying AI across all these major operational cost centers. We're talking revenue cycle management, prior authorizations, medical coding, surgical scheduling, the whole shebang. Historically, this backend is incredibly complex, meaning hospitals often lose between 3 to 8% of their total collectible revenue just due to claim denials, undercoding, and delayed submissions. But by applying AI to these areas, organizations can catch misdiagnoses, clean up insurance claims before they're ever submitted, and prevent upfront denials, which dramatically shores up their financial performance. Companies like Akeasa and Codametrics are proving that AI can accurately review a literal mountain of complex clinical data to ensure hospitals capture their revenue efficiently. For example, Akeasa uses generative AI to audit clinical documentation and pinpoint missing information, while Codametrics has built an autonomous coding platform that immediately applies the correct medical codes. Early adopters of these back-office AI systems are already reporting 10 to 15% revenue capture improvements in just their first year. For a hospital system operating on razor-thin margins, that double-digit improvement isn't just a nice little bonus. It's often the difference between thriving and going bankrupt.
Now, with all these billions of dollars in venture capital flowing in, and with AI companies currently commanding a 19% premium on average deal sizes, it is totally fair to ask, is this just another tech bubble? We saw a massive digital health bubble back in 2021, driven by telehealth companies that eventually crashed. So is this current AI wave just more of the same hype?
Well, according to industry analysts like Bessemer Venture Partners, this time is fundamentally different. It's not a bubble, because AI is delivering measurable, mission-critical return on investment today. We aren't talking about abstract user growth projections 5 years down the line. We're talking about quantifiable productivity gains happening right this second. AI is shifting from being a simple software add-on to becoming the absolute core operational infrastructure of the hospital.
Section 4. From Tools to AI Agents.
This brings us to the most exciting breakthrough in this entire explainer, where the landscape completely changes. The crucial point here is the definition of an AI agent. An agent doesn't just assist you with a task, it actually executes the entire workflow on its own. It integrates reasoning, planning, and tool use to complete a multi-step process from start to finish without a human needing to hold its hand or click approve every single step of the way.
To put it simply, tools assist, but agents act. On one hand, an AI scribe tool like Abridge or Suki is passive. It listens and summarizes what already happened during the appointment. It's incredibly helpful for sure, but it's looking backward. On the other hand, an AI agent is active. It takes the next step autonomously. It logs into the system, it initiates the EHR action, it coordinates the surgical teams, or it literally picks up the phone and calls the patient for a post-op check-in.
We are already seeing this deployed in the real world at an incredible scale. Take Hippocratic AI. They built generative AI agents that act as virtual nurses, autonomously calling patients for discharge follow-ups and medication reminders. Those are critical tasks that human nurses usually have to squeeze in under intense time pressure. Meanwhile, Qventus acts as a highly intelligent operational agent for hospitals. In 2024 alone, their technology eliminated 36,000 excess patient stay days. Why does that matter? Because that frees up desperately needed hospital beds for patients waiting for care, and it allowed 14,000 additional surgeries to be scheduled seamlessly. That is the raw power of Agentic AI. Section 5. The Future of Care. Let's look at how this shift to agentic AI is completely rewriting the economic and practical foundation of healthcare. The financial impact of this shift is frankly an economic shockwave. When you look at the unit economics, traditional healthcare software companies typically generate about $200,000 to $400,000 in annual recurring revenue, or ARR, per full-time employee. But AI-native companies? They're generating between $500,000 to well over $1 million in ARR per employee. This massive gap exists because they're bending traditional growth curves. Their AI agents do the heavy, repetitive lifting, allowing these lean companies to scale operations at a fraction of the traditional cost. This incredible efficiency has birthed an entirely new business model known as services as software. We're entering a new era where companies don't just sell software subscriptions to help humans do their work faster, they sell the completed service itself. Because the labor is powered entirely by autonomous AI agents, these companies can deliver human-quality service outcomes, like perfectly coded charts or fully scheduled operating rooms, while achieving massive software-like gross margins of 70 to 80%.
I want to leave you with a final provocative thought as we wrap up this explainer. If AI agents are successfully taking over this massive administrative burden, reading the complex charts, generating the clinical notes, scheduling the critical surgeries, and even conducting the routine follow-up phone calls, how will human doctors redefine the art of patient care? When the glow of the computer screen is finally removed from between the doctor and the patient, what does the future of that pure human connection actually look like? It's a fascinating question, and it's one we're going to be watching closely as this technology continues to evolve. Thank you so much for joining me, and keep learning.